Hi, warriors. Hi, healers. Welcome back to the podcast. If you're listening to this on the Prepare Patient podcast or watching this on my YouTube channel, welcome, welcome, welcome. Thank you so much for your support. I really appreciate all the comments we've been getting so far, all the likes, all the shares. This acknowledges power. So I just want to say thank you just to start this episode. If you are new to any of my platforms, you've never seen me before, you don't know who I am. My name is Dr. Jennifer Genty. I am a functional medicine doctor, and I help my patients identify the root causes of the digestive issues, whether it's gas, bloat, constipation, diarrhea, colitis, abdominal pain, acid reflux, or the root causes of the hormonal imbalance, whether it's PMS symptoms, PMDD symptoms, menopausal symptoms, irritability, mood swings, like the pain that we get, the anxiety that we get. I also help my patients identify the root causes of weight gain. Okay, so that they can not only function but thrive in the body they were born in and created for. So if that sounds like you, if you have any of the symptoms, I would love to support you. But in today's episode, I'm going to talk to you guys about symptoms. You probably saw the title. You probably like, okay, what is this all about? This doctor's crazy. Who wants to have symptoms and signs, right? It's painful, it's irritating. Like, we don't want any of that stuff. I want to invite you to have a different mindset when it comes to symptoms, your health symptoms. Okay, what are symptoms? Symptoms are a way of your body communicating with you. That's the way I view symptoms. Okay. So, and I'm referring to, again, weight gain, hormonal imbalance symptoms, digestive symptoms, autoimmune symptoms, right? The hair loss symptoms, the headache symptoms, anxiety symptoms, mental illness symptoms, the overwhelmed and the burnt out, lack of motivation, the brain fog, right? The acne, the psoriasis, uh, the fatigue, the like all the symptoms. Like if you live in your body and you're not functioning the way you would love to, and you are feeling uneasy, like the sleep issues, like whatever that you are not loving right now, we're gonna consider that as a symptoms. Now, signs are things that you can see, right? Like acne is a sign, psoriasis is a sign, like your bloated stomach might be a sign, arthritis, right? With the stiffness, psoriatic arthritis might be a sign. Um, but anything that you can see, you can put your hand on, you can look like a rash. And hair loss, like if you see your, alopecia, that's also a sign, right? So we have signs and symptoms. And when I speak to my patients, when they come to me and they come to me frustrated, they come to me like hopeless, hopeless, and they just want to fix the problem right away. And I asked them, what are your symptoms? And they tell me a laundry list of symptoms. And I told them, good. And they look at me like, what? I'm like, yeah, it is awesome that you have symptoms. That's a good thing. These are from God, the higher power, whoever you believe in. That's where these things are coming from. And they look at me and be like, well, I don't know how you feel about this, Dr. J, but I don't want to have headaches, right? I don't want to have migraine. I don't want to be nauseous, right? I don't want to have bloated stomach looking like I'm pregnant. I want this weight off. Don't want to have pain. I don't want to be on medications, right? I don't want to experience side effects on medications. I want my high blood pressure to resolve. I want my diabetes to go away, my high cholesterol to literally get out of my body, right? I want all my lab values to be normal. And I understand that. And I have empathy for my patients, right? But your body it's like a communicator, right? So you don't know what you don't know, you don't see what you don't see. There has to be a way of your body telling you what is going on intracellularly inside of your body, inside of your cells. We see the physical aspect of your body, right? We see the external aspect. We can see that I have rash here, but if you don't have a rash, how are you going to know there's like severe inflammation? Your immune system is weak, right? You're holding on to water weight. You need to detox. You got to have symptoms because that's how your body is going to tell you what is happening intracellular. I tell my patients all of the time that disease is a cellular process. Until you identify the root causes and you fix the issue at the cellular process, like cellular level, you're always going to be sick. And if you are in the conventional space and you believe that a pill gonna resolve and you know, like cure every ill, then I would love for you to reconsider, right? Taking a medication for more than a week, for more than 2 weeks, is really dangerous because you actually numbing the communication system between yourself and your body. Okay, so let's use this scenario. I have headaches, right? I have headaches. I've had headaches for a long time. I don't know why I have headaches, right? I go to my doctor, neurologist. They give me medication for headaches, whether it's propranolol or some amitriptyline medications, like whatever. I have headaches. So the first thing we're gonna do, of course, we're gonna go to the doctor. We might go to Walmart or pharmacy and take Tylenol. And when that doesn't work, right? Because over time, when you first take a medication, your body's gonna be like, okay, you decrease the stress in your body. And then after that, the headaches will come back. The minute you stop taking the pill, the headaches will come back. Okay. So we don't really pay attention. We don't really ask ourselves, we don't really investigate why you have the headache, right? I'm gonna go to my neurologist, go to my primary care doctor, and take a quick fix. Yes, you can do that because, of course, when you have headaches, you want relief. You want relief now, so you're gonna do whatever it takes to get relief. But we should always investigate because you having headache is telling you, right? Your body's telling you something is off, right? So what I tell my patients to do, besides taking the medication, doing whatever else for relief, always go back and investigate. Do you have headache because of stress, right? If the answer is yes, but what's causing the stress? What is the stressors? Do you have headache because you are dehydrated? If the answer is yes, then can we get some more hydration? Do you have headache because of food sensitivities, right? Do you have headaches because you are, eating food you're not supposed to, dairy, like you're lactose intolerant and you're gluten intolerant? So do you have celiac disease? Do you have headaches because you have leaky gut because there's so much built up of toxins internally? So those toxins are creating, creating gap into your intestinal lining, and now they sip it into your bloodstream and travel into your head. So us taking the medication just to numb the headache is not gonna fix the problem. The worst thing we can do if we don't listen to the symptoms, because again, I think symptoms is a great way of you paying attention to your health. Okay, slow down in it, whatever you're doing, slow down in life, giving yourself some TLC, right? Paying attention to say, okay, I didn't have this today and I have that now, right? How can I fix it? Who do I need to work with? What investigation I need to put in place to find out the reasons why I have the headaches, I have the gassiness, I'm bloated all the time, I'm sluggish all the time, I have, foggy brain all the time, I have, yeast, urinary tract infections all the time, I'm always getting a cold all the time, right? I'm always, like, seasonal allergies is not normal. So your body is literally communicating with us. I've seen patients come to my practice literally ignoring the communication system, and then they ended up having a major issue more than they started with, and they ended up having cancer. Because your body is like a baby, right? When things are happening, your body does nothing. And then as the things are accumulating, toxins, inflammation, just stress, right? Accumulating, then the baby start crying, right? Because the baby's trying to get your attention. So symptoms and signs are gifts from God because that's a way of your body telling you that it needs some TLC. And I know life is busy. We all have jobs to go to, we have family to take care of, people to be present for, and we ignore the symptoms. That's how we lead to autoimmune. That's how we go to cancer, is the constant ignoring of the symptoms. Now, I know many of you guys that are watching this video, listening to the podcast, might actually not ignoring the symptoms, going to your doctors, doing all the blood tests, all the imaging, to be told that everything is normal. What I need you to do, I need you to really focus on a doctor that focuses on root causes. So when you speak to your doctor, you make your appointment, ask them, do you identify root causes? Do you focus on investigating the root causes? Okay, if the answer is yes, then do you have a plan to address a solution to address the root causes? Nothing happens by accident, right? You didn't wake up today to have a headache by accident. You didn't wake up today to have food sensitivity, have a rash by accident. Nothing happens by accident. And usually before you experience the symptoms, these things have been manifested. The inflammation has been there months before you actually feel it. Okay? The toxins have been accumulated months before it can actually come out to your pores or can make you, clog your lymphatic system. Right? The diabetes has been manifested before your doctor was able to diagnose you with high glucose, hemoglobin A1C, and insulin. So by the time you experience the symptoms, things have been happening intracellularly, leading for you to feel the symptoms. Symptoms are not to be ignored. They are not to be numbed. Okay? They are not to be managed. You must eliminate your symptoms. There are so many solutions out there to help you with the symptoms and the signs, right? First, we identify the root causes, right? If in my world, I'm a big believer of detoxification. You have to remove things that are there before you can replace with other things. And then you address inflammation, and then you boost your immune system. You fix the gut. If you have hormonal imbalance, once you identify the root causes, you can see your progesterone, testosterone, estrogen, estradiol, your DHEA, your cortisol hormones, your thyroid hormones, your insulin hormones, then you can literally put things into place to fix those hormones. All right? So if one of those people that are looking for answers and you have so many symptoms, things you didn't have before, and then you're working with a doctor that's not really focusing on addressing the symptoms or just giving you prescriptions, I'm telling you, you're on the path of having something serious and major down the road because your body will not stop sending you signal, right? And then you can do trial and error, right? My blood pressure is elevated. I go to my doctor, I give him one medication. The medication doesn't work. Another medication. So that's trial and error. We can prevent trying and error by identifying the root causes, putting a plan in place to address the root causes, to address the symptoms, to eliminate the symptoms. And then when you have a program that is actually working for you, I promise you, your symptoms will decrease naturally, right? Like no medication. We're not numbing the symptoms. You're actually fixing the problem at the cellular level, right? Always go deep into the cells. Always, 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 always address the cellular aspect of your health to really see the symptoms melt off of you. Symptoms are not normal. I agree, they are not normal, but it is a powerful way of your body communicating with you. It is the only way your body can catch your attention, right? It is the only way your body can actually scream out loud and asking for help. And so many of us just put the symptoms to the side and we keep moving, we keep going, we go, 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 go until life slows you down. What does that look like? It looks like you're going to the hospital, admitted to the hospital. It looks like you're having a terrible diagnosis that you don't want, you weren't expecting. Okay? So whether it's one tiny little headaches you get once in a blue moon, you need to pay attention to that. Whether it's the bloat that you get intermittently, you need to pay attention to that. Whether it's the weight not falling off of you, you're trying all of the things, you need to pay attention to that. Whether it's the blood markers that are being done that is super elevated, not quite there elevation, but it's going up, right? Like when you look at the reference range, that's your body sending you all type of messages, all type of information, asking for help. Because at the end of the day, we don't have a microscope, right? We don't have a magnifying glasses to look to see what's happening internally. We depend on how we feel, right? To determine what will be the next step, the next move for you. Now, when I wake up every day, I ask myself, how do I feel? Okay? So if I wake up one day and I'm sluggish, I must investigate why I'm sluggish. Did I not sleep the night before? Okay, was my sleep interrupted? Did I eat something that I wasn't digesting properly? So there's always something. You always go back 24 hours, right? If I'm having anxiety, which I am a very anxious person, I ask myself, what's causing the anxiety? What is happening or not happening? How can I fix it, right? And I always go within to get the answer. What did I do? What am I not doing? Like if I'm stressed out, why am I stressed out? I'm burnt out, overwhelmed. I have ADD and I'm all over the place. Why? Slow down, listen to your body, embrace those symptoms for whatever they are, telling us, and just find your solution. Okay? So I'm not saying for you to do nothing about the symptoms. I'm just asking you to use a negative and turn that into a positive, to look at it a different way, with a different mindset, a different lens, a different perspective, and knowing that those things that are happening to you, the way you feel today, right? The signs you're seeing, the things that you're not loving about your health, is your body communicating, asking you to make a change, right? It's your body telling you something is off intracellularly. It's your body loving you, saving you, guiding you, protecting you. Okay, if you believe in God, God is always communicating with us, right? If you believe in a higher power, depends on who you believe. But I believe in God, so I know for sure when I am on the go, not taking care of myself, not practicing self-care, not slowing down and evaluate my health, He communicate with me. My back, I start having back pain, maybe have a little brain fog. Like I know that I'm like, okay, all right. So this is a way of me slowing down. Now, before life slows me down later. Okay? So what are your symptoms and what is your body telling you? That's the question I would love to ask yourself, right? If you have autoimmune, it's a weak immune system. Do you have silent dormant infection? Again, if your hormones are not balanced, right, you're going to pre, peri, and postmenopausal. And society is saying you should have low libido and feel like crappy. Is that true? How can you fix that problem? Always ask yourself, write down all your symptoms, write it down. I know many of you guys are not going to do this, but I'm telling you, write it down. Write it down. If you can identify the onset of it, go back and say, okay, I wasn't bloated today. I ate this and I'm bloated. Right? I didn't have the acid reflux until I ate this. So I have acid reflux all of the time. Change your lifestyle, change your diet, manage your stress, right? What can I do naturally to decrease the acid reflux? My diabetes is not resolving. The medication is not working. What can I do? What is my body telling me? Right? And another thing too, another way that your body's guiding you when it comes to taking medication is you reacting to the medication. If you take a medication, you are reacting to it, is the body telling you it doesn't want that chemical in you, right? I know people that have taken like antibiotic and they do terrible with the antibiotic. I know people that have taken sleep medications, they have tons of side effects. I know people that have taken, other medications that the body's literally telling them no, right? So the worst thing you can do is just take something to counteract what your body's telling you to decrease the side effects or changing the medication altogether. But no, you need to really listen to your body. What are the symptoms telling you? What are the signs? What is it telling? Your body's telling you something. If you don't listen, you're gonna pay for it later on. All right. So when patients tell me I have symptoms, I tell them good. And they look at me like, okay, no, it's not good. I'm suffering, you're not. I'm like, well, it's communication. Let's just write it down. Let's investigate and let's fix it. Because if you don't have symptoms, you won't know what to fix. Right? It's like, I don't feel crappy. How do I know what to fix? And the people that have no symptoms are too busy to actually evaluate and assess themselves, that have signs they are like, completely ignoring. Those are the people that wake up tomorrow or the next day with a terrible information. Right? It's like I had no stomach issue. I have a terrible stomach issue today. I went to the doctor. I found out I have stomach cancer. Right? We don't want that. It's like no. Okay. So thank you so much for watching this video. I would love for you to subscribe and share with all the people you think that can benefit from this, because my goal is to really put out the information so that people know there are other options and how involved they should be in their own care and how they should partner up with the doctor. There's so many things you can do, right? The worst thing you can do is just do not stay still, right? Just Don't take ownership of your care. Don't, just transfer everything about you to your doctor. That is the worst thing you can do. You need to be involved. You need to ask questions. You need to see what's working, what's not working. You literally need to be verbal as much as possible. All right. So if functional medicine is something you're interested in, and you want to identify the root cause, and you love everything that I'm saying, everything's resonating with you, because I do have a different outlook when it comes to medicine. I usually use all the things that people are telling me as a way to guide me in helping them. So I'm weird, I know. So if that's something you're interested in, just reach out. You can schedule an appointment. You'll see the link below, the phone number below, and I would love, love, love to help you and embark on this journey. If our first investment is just to identify the root causes, and then you can take the information and do what you please with it, then that's what we're gonna do. All right. Until then, you have a rest. You have a beautiful day, and thank you for watching this video. Thank you for your support, and I'll see you next time.